Well, hello, Dr. David Wipperman here, and today I'd like to teach you a couple stretches for the muscles in your neck and shoulders. Now the first one, what you're going to do is you're going to find yourself a flat wall or the back of a door in your home and proceed to perform these stretches there. Now what you want to do is you want to stand with your feet about shoulder width apart. Your bottom, the tips of your shoulders, and the back of your head needs to be against the wall or that door the entire time that you stretch. Very easy. What you're going to do when you're in that position is you're simply going to let your head slide your head to the side while keep looking straight ahead. You're going to hold that position for the count of 20 seconds. You're going to relax and do the same thing the opposite direction. Slide your head, hold it for 20 seconds, and relax. Now, when you do the stretch properly, you're going to feel it stretch the muscles on the side of your neck from the back of your head all the way to your tip of your shoulder. Now the thing is, if you don't do this properly, and there's actually a couple mistakes I see people make. One is this. One is that instead of sliding their head, they rotate their head and look straight down. That's not going to do anything to stretch those muscles on the side of your neck. Okay? Or the other thing they'll do is when they slide their head, they're keeping their shoulders tight, and they slide their head and their shoulders are up around their ears. And again, these muscles are tight, you're not going to be able to stretch them like that. So make sure when you get in that position, you let the air out of your shoulders, so to speak. Relax them, drop them, and just let your head hang so you're feeling that nice pull and that nice stretch in the side of your neck. Now when you do this stretch properly, you're going to feel stretching on both sides. It's going to take you about 2 minutes to do that stretch, but it's very effective for those neck muscles. Now the next one's a little bit different. You're going to be away from the wall just a little bit. And what you're going to do is you're going to stand, you're going to place one of your hands in the back, in the small of your lower back. Now I always tell people to actually place it on your bottom, because if you get it up too high, those muscles are going to tighten up. So if you place it on your bottom, keep your shoulder muscles relaxed. What you're going to do then is, if your one arm's up, you're going to drop your head the opposite way and look straight down towards your foot or towards the floor. So it's going to look something like this. Alright? Again, you're going to hold that position for 20 seconds. Relax. Do the same thing the other way. Drop your head. Hold it for 20 seconds. And you're going to alternate them back and forth 3 times each way. Just like the first stretch, you're going to slide your head back and forth 3 times each way. So do one side of your body, relax, do the other side of your body. Again, make sure you're not holding your breath when you do any type of stretch. And also make sure that you don't try to push to see how far you can go. Some people feel like, hey, it feels good in that position, I want to go just a little further. And if you go a little further, again, you're going to tighten up those muscles or actually strain them. So those 2 stretches are great stretches for the neck and muscle shoulders, or muscles in your shoulders. Well, what happens is the first stretch will stretch the muscles on the side of your neck. The second stretch is going to stretch those muscles from the back of your head between your shoulder blades. And both of those muscle groups are what you use for probably 50 to 75% of your range of motion, as well as holding your head up. And then the muscles that actually get injured in most different types of neck injuries, car accidents, that type of thing. So I hope you can understand those stretches. They're very easy to do. If you do both of them, they take maybe 2 minutes apiece. Combined, you're talking 4 to 5 minutes. I usually have my patients try those twice a day, because it's going to take you about 2 weeks before you start feeling that improved range of motion. But once you do, you'll get your range of motion back, which will be much easier for you to sit behind that computer and type longer during the day, drive your car, turn and look in traffic, that type of thing. So good luck with those, and let's get started.